Well, welcome everyone. Thank you for coming to our fourth annual Cancer Symposium. I know you're all busy, so we appreciate your attendance. And I know we have a wonderful program and a worthwhile program for you, so we'll make it well worth your time. I'm Jerry Tatar. I'm the Tatar that's mentioned up there in the title. And usually, by the way, it says updates in something. This year we have updates and controversies, so I'm actually very anxious to hear what all the controversies are about this subject. But we thank you for coming. This is our fourth symposium. The first one was we dealt with the advances in metastasized cancer. The second one, we talked about things that were going on in the treatment of breast cancer. And last year, we handled the issue of lung cancer and the customized treatments that were being adapted for the treatment of lung cancer. And this year, as it says, the fourth one, we're going to be dealing with prostate. So we're very proud of this seminar, and I'm actually very proud to be associated with it. I work with Dr. Kyler, who I'll introduce next, and he'll introduce the speakers, and Dr. Einstein from Kettering to help us put this program together. But as you can see, we're at Sinclair. We have this symposium for whether you work at Kettering or Premier or Children's or independent type medical systems. We're just here to talk and learn about subjects that are very, very important to all of us. This is all very personal to me. That's why I do it. I'm not at all associated with the medical community. My issue, or my reason I got involved, was back in 2007. My wife, Lorelei, passed away from melanoma cancer. And I can remember all of the progress of that very vividly. It was discovered actually that it had come back in 2006. She actually literally had melanoma like back in 1970, and it was taken care of, and it literally 25 years later it came back in exactly the same place, and which was viewed as fairly unique, but it happened. And of course, you all deal with this almost every day as far as dealing with patients and that, but if you're not in the medical system, you know, you just kind of go about your life, and then all of a sudden somebody says the word cancer to you, and it's very, very traumatic, and it changes your life. And as I went through that in support of Lori for that year, I learned a lot of things, but the biggest thing I learned was how difficult it is for both the patient and those people that were supporting the patient to, I don't know, always make sure that you're getting, in quotes, the best treatment possible and the newest stuff and the newest advances, et cetera. And I remember sitting at the computer for hours on end with typing in melanoma and trying to learn what the heck the latest stuff was. And of course, there are a lot of well-meaning people, and they come up to you and say, well, you know, you ought to go to Mayo Clinic, or you ought to go to Anderson, or you ought to go here. Somebody said you ought to go to Germany. They have a new treatment. And, you know, I could barely get Lori to get her chemo, which was 3 blocks away. I mean, she had very little energy, et cetera. So you go through that, spending a lot of time. It's very stressful. And we had great doctors here. I mean, Dr. Raju, I didn't see him. Is he here today? I don't know. But Dr. Raju was great. We went over James for a couple of visits, et cetera. And I learned a lot about melanoma, and back then there wasn't much you could do about it once it got rolling. So, but after it was all over, I learned that, you know, it would be good if we're sure, as sure as you can be, that our local community has the best advice and counsel possible about the different types of cancer that are out there. And we all know how much progress is being made daily. I have no idea how you all keep up to speed on it, but I thought maybe we can do something to help that. I happened to meet Dr. Kyler and Dr. Einstein through, you know, a friend, and we sat and got talking about this, and they had the idea for this symposium, and I was very glad to support it, because I thought it could be at least a piece of the puzzle in helping this community make sure that we have and understand the latest advancements in the treatment of cancer. So that's why I'm here, and I assume that's why you're here, to learn the latest stuff. And as it says up there, today is prostate. I will also tell you this is a little bit of a personal interest, because in 2008, I came down with a case of prostate cancer. So I actually do understand some of this, although not a lot of it. But I know there have been a lot of advances. With that, Dr. Kyler, I hope that's a good introduction for you to understand why we're here. And this is the guy who puts it all together. So thank you.
Oh, I just want to say thank you very much to Jerry Tatar for making this symposium possible these past 4 years. I think this has been an absolutely fantastic asset to the community, and we couldn't do this and do this well without his support. So I'd just like to thank him again. So we have 3 outstanding speakers in the fields of urology, radiation oncology, and medical oncology today. Join us from across the country. They have authored numerous peer-reviewed articles, invited articles, book chapters, are members of multiple committees, and are just, we're very, very fortunate to have them today.